In my first segment, I was in the process of talking about um, how I ended up at Piedmont Hospital um, during the first part of my diagnostic process. Um, and I think where I left off was I was talking to the psychiatric social worker, and she had just explained to me that she would have to put something down. She would have to, do an assessment, um, but just as a formality, but that she didn't feel that there was anything psychiatrically wrong, and that this um, grief that I was having was situational and entirely understandable given the fact that I was um, becoming increasingly disabled very quickly. And I was just having difficulty adjusting to the new level of disability and, just the uncertainty of everything that was happening um, around that. And so I didn't know this, but she had put down just a very light diagnosis because, they can't get paid for grief counseling. Insurance doesn't cover that. So she just chose the most innocuous diagnosis she could and put it down the chart. I didn't know that at the time, but I knew that she probably wouldn't be able to get paid considering what my complaint was that I had asked her to come in for. Um, but I really didn't think much about that at the time because I was really focused more on why I was really there, which was for physical reasons anyway. And I just really informally wanted somebody to talk to, and that was it. It wasn't any big clinical deal. And so as time went on, when I was in Piedmont, they had me on IV saline because of the autonomic um, dysfunction that I was having. I was having the near fainting spells, feeling really fatigued. Um, I was having a lot of problems in terms of I was even having urinary retention and chronic constipation, uh, just kind of the whole 9 yards with my blood pressure going up and down and all over the place even within the same given day. And so they had me on IV saline. I didn't know at the time. I didn't know anything about dysautonomia when I was in there at the time. But one of the attendings, primary care type attendings that came in one morning, came in and he said, well, I wanted to see what would happen if, I put you on the saline and then took you off for 24 hours to see whether your symptoms got worse or whether they stayed the same. And he said, yeah, he said, well, what I noticed is that when you were on the saline, that your symptoms started getting better. And I noticed that too. And I didn't really make the connection, but I knew that, things were starting to stabilize as I was in the hospital during that time. And I was starting to be able to eat better. Um, I didn't feel as thirsty all the time. Um, I was eliminating more regularly, both, you know, pee and the other and everything. And the fainting spells, the near fainting spells were starting to stabilize too. And he had said to me, he said, yeah, that, it did seem to help. And then when I took you off it for about 24 hours, then your symptoms spiked again. The blood pressure dysregulation got worse and all that. And so he said, in my opinion, I think it would be best to put you on it continuously. And I said, well, yeah, I said, I'm okay with that. If it works, then yeah, do it. And so he put me back on it continuously, and then there again, my symptoms started resolving. And I need to make very clear that I didn't even know about this until, and he basically did almost like a blind study on me to see if this worked. Because see, I wasn't at that time, I hadn't read up on dysautonomia and what you do for it or anything like that. So this was completely blind to me as to whether this worked. So I know that it wasn't placebo effect or anything like that because I wasn't educated at that time as to what people did for dysautonomia. And I didn't know that this was one way that they treat it. And this doctor at Piedmont Hospital did this kind of as an experiment to see whether it would actually improve my dysautonomic symptoms. And sure enough, it did. And when he took me off it, the symptoms got worse again. So he put me back on it and they started to get better again. It wasn't a cure, but believe me, I was really grateful to have it because of the fact that, you know, feeling like this is miserable. Feeling like every system in your body is taking turns going haywire is just, it takes a toll on you. And when it's up and down and up and down, and your blood pressure is up and down and up and down, and, you feel stable for a little while, and then you feel like you're going to faint any second. I mean, it really takes a toll on you. And so when he did this and he explained it to me, I was really glad to have that. And, so then, you know, I guess it was toward the end of the hospitalization, I was told that, they were going to get ready to discharge me pretty soon. And although I wasn't really quite to the point where I was ready to be discharged, I was really kind of glad to go home. And, the female neurologist that was the admitting neurologist in that hospitalization had talked to me, and she said, we haven't really been able to diagnose what is wrong with you, but I think that you should go somewhere to, an advanced testing center where they, have the facilities and the expertise to deal with unusual movement disorders. Because she said, I don't know for sure if it's ALS or not, but, it could be something that's less common, and you have some features of that, but you have some features of other things too. So it would be good for you to get a really good, assessment, a more advanced assessment than they can do here or at Emory. And, we really don't have the facilities here at Piedmont in order to do all of that here. And so I would suggest that you go to Mayo Clinic or someplace like that, where they really are experts in these kinds of things. So I said, well, yeah, I'm willing to do that, and I really want to get to the bottom of this. And so as I approached the time for discharge, um, things were, I guess, we were trying to figure out, I guess, how things were going to work and everything. And I think, yeah, I think what happened, toward the end, the last test that I had was the EMG, and it had to be rescheduled because at first they didn't get the order from my neurologist for the Demerol, or morphine. I can't remember what it was. It was something like that. I just can't remember right at this point. But I think it was morphine actually. But they didn't get the hospital didn't get the order together in time, and so they put it off till toward the end of the hospitalization when they could get that in place so that I could be as comfortable during it as possible. So they finally got that in place, and then they called me down for the EMG, and I went in there, and you know it was kind of scary, because I really didn't know what to expect except what I had read about it and talked to other people. And I heard that it was painful, but I really didn't exactly know to what extent. And so there was a tech there that came in and sat there with me and kind of held my hand when they were doing it. And the doctor that was in there performing it turned out that he just did a partial one. He just did it on the left side and a few muscles of the leg and a few muscles of the left arm, and really didn't do a full one. And at the time, I really didn't know if that was not necessary or exactly why he did that, but you know, he did it that way. And I noticed that the part that was the worst for me was not so much sticking the needles in, but it was more the part where they shock you. And one of those was fairly painful. And I actually, part of the way that my brain is wired, I don't scream like other people. What comes out of me is more like a grunt. I don't even know how to describe it, but I have certain idiosyncrasies. The other thing is that I've never, ever since I was a child, I've never been able to point my toes. I just, for some reason, my brain doesn't connect with the muscles in my foot, in my toes to be able to do that. I've never been able to. And I can move them in that direction slightly, but as far as really pointing my toes, I've never been able to. I'm just physically unable to. And the doctor had told me to point my toes and as part of the test, and I literally couldn't do it. I tried with all my might, with strained with all of my muscles and my entire body to make it happen, and I couldn't. So the only thing that he could do was to push my toes down for me. And so that's how we had to do that. But at some point, I think when the report came out, they did find some slowing in some of the muscles in the left leg. And and there wasn't they didn't put down the exact rate, but it was noted. And I think it was gastrocnemius muscle and I think one or two others in the left leg. um, and it was just sort of a general statement that slowness was found in these muscles in the left leg, and specifying which ones. And but then I think soon after that was when I was to be discharged. And then a doctor came in on a Saturday and kind of in a whirlwind fashion came in all of a sudden and said, "You're going to be discharged." I mean, like on a dime. I didn't have any notice or anything like that. And it was over the weekend. And I said, "Well, I don't know how I'm going to get home because I have Medicaid transportation, but usually they require some advance notice." And he said, "Oh, that's okay. We can, arrange for you to get transported home by ambulance." And he said that, um, they had been kind of pushing him to discharge me because of the fact that right now all they could do was pretty much supportive care, um, because of the dysautonomia, that there's not a whole lot of things that they can do to treat that. But the saline was, one form of treatment, but it's still considered supportive care only, really, to manage the symptoms and all that. And so, um, so he said, "Well, they've been on me for a while, and I didn't feel that, you were really ready to go home. I wanted to wait until you stabilized some more and everything." And but I said, "Well, could you possibly wait until Monday? And that way, people at Emory, my regular doctors, will be in, and they can write gap orders or whatever needs to be written for home health care because I was supposed to have home health care when I got home. And he said, well, that'll be kind of hard for me to pull off to be able to wait until Monday because they really have been, on me to, to discharge you. And I said, well, could you write a gap order? Because if home health care is supposed to come in on Sunday, then, if you write a gap order for the saline to continue that at home, then maybe Emory can pick up where you left off on Monday when they're back in the office. And he said, well, yeah, I guess I can do that. And my understanding was that he was going to write the order and then I was going to be discharged and then I would get home. And, when they came to do the assessment the next day, that, we would get that started. So that way I would have no gap in care. Since that was the only thing they were really able to treat me with right then. They didn't know what the movement disorder was, and they didn't know if that and the dysautonomia were related or two separate things or what. And I didn't know how long it would take for me to get a more advanced assessment at one of these major centers out of town. So what happened then was it came time for me to be discharged. Transportation was called. I was waiting for them to come pick me up, packing up my stuff and all that. And I asked to have a release of information so that I could get my records transferred to my doctors at Emory. And I figured I'd go ahead and take care of that before I left so that that was in the works and that it wouldn't take too long for them to get those records. And still, I was at that time entirely thinking the best of the doctors that I was seeing at Emory. And I had no idea that anything untoward or anything, unsupportive was going on there. And I legitimately thought that, they would want to have those records and they could, for the purposes of continuity of care, that I would have those records transferred to Emory and everything would work out, that they would help me get to the centers I needed to go to, the referrals I needed, and that things from there on out were going to start coming together. So, turns out 5 minutes before I was discharged, I asked the nurse just to be extra conscientious. I mean, I'm very conscientious about things. I want to make sure that nothing fell through the cracks. So I asked the nurse, did he write the order for IV saline for home health care when I got home? And the nurse said, well, let me go check. She went back there to the nurse's station and came back and said, no, he didn't. So, I said, why not? And apparently he had changed his story after he had spoken to me and just, acted like, it wasn't really that important or something. So I really didn't know what to do, and it was really too late to cancel the discharge. So I thought, hell, I'll just go home. And I didn't really realize that I would have any adverse reaction to going home without any treatment other than, I did have my other medications, my maintenance medications. I'm on tramadol and ibuprofen and tizanidine for my spasticity and Keppra for my myoclonus. And they had actually, I wanted to mention that in the hospital, I was on 500 milligrams Keppra previously from Emory, and the 500 milligrams seemed to work pretty well at first for the first 2 or 3 days, and then I had breakthrough of symptoms. But in the hospital, the neurologist there had upped it to 1,000 milligrams, and that was exactly the right dosage. And it didn't fully get rid of it, but it cut it way down. I wasn't up for 7 or 8 hours straight, unable to go to sleep. And, I still have myoclonus every time I start to fall asleep. Maybe the first 2 or 3 times I try to drop off to sleep, but then it stops and then I'm able to get to sleep and sleep through. But yeah, they had increased it to 1,000 milligrams, and then that was kind of the right, turned out to be just the right dosage for me, to get it, under control so that I could sleep enough, per night. So, I was discharged with my regular medications and all that, but not the IV saline. And so as time went on, I found that Emory didn't pick up the ball there, and my primary care physician, who up until that time I had been pretty close to, and I felt we had a good, strong doctor-patient relationship. I noticed some behaviors in him that he started stalling with a lot of things, and he wasn't really actively seeking the proper places to refer me to. And at that point, I really didn't know. I didn't even know that they had a movement disorders clinic at Emory. The only one I knew about was the ALS clinic. So I said, well, can you refer me there? At least maybe we can find out if that's what it is, or if it's something else, then he can refer me somewhere else. But you know, we probably need to do something, because, I need to really find out what's wrong, and take some action to do something about it. And there again, it just seemed like everything was moving at a snail's pace, and I didn't know why. He wasn't really writing the prescription for the IV saline. He wasn't referring me anywhere. And I think at some point, and I don't know exactly, there's so much that happened, there may be some things that are out of place or something like that in what I'm telling you. It's not intentional, but, there was just so much that happened, that the course of events was, there was so much involved in it that I may leave things out or whatever, but it's just because it's so much to keep track of. But uh, at some point or another, he had supposedly sent in a referral to the ALS clinic at Emory, and there were some strange occurrences that happened with that, where they were telling me on the other end that they were missing some pages in the referral. And apparently he was supposed to have written more details about why I was being referred and what my symptoms were and all that. And all it said was refer to, and then the name of the doctor who is the head of that clinic. And they said, this is not enough. We need to have, more detail than this. And they made it sound as if pages were missing, like maybe things were displaced or something. So it didn't really occur to me that it hadn't been turned in the first place. I thought that he had submitted the referral the way that they're supposed to do it, and that maybe, maybe the pages got misplaced, some of the pages of the referral. But the nurse on their end told me, well, no, there's some things missing, and we need more information. And he's not going to approve the referral. He's not going to accept you unless we have all this information. And I really didn't know what was going on, but I went back to my primary care physician, and I then tried to contact the guy who was the head of that ALS clinic, and I said, I don't know what's going on. And they got back to me, and they sort of said something to the effect of, well, that he didn't give a proper referral, that there needed to be more information in it than what he was supplying. And at first, I kind of got offended, because this is a doctor that I had been with for almost 13 years, and I had a relationship with him. I felt that I trusted him at the time. I just couldn't imagine why he would do that to me. I mean, I just couldn't fathom that. I said, if he says that he submitted everything he needed to submit, I believe him. And, I said, I take his word for it, because we have a relationship, and I trust him, and I don't know why he would not submit a proper referral. Um, and But as time went on, there were more and more red flags showing up. And 4 days after I was released from Piedmont to go home, I found myself in the same position as I was before I went into Piedmont. I woke up early in the morning, intensely faint, with GI spasticity, feeling absolutely like hell. And it was to the point where I couldn't stand it anymore. And at that time, I finally had home health care set up, and they were coming to check on me and take my blood pressure and do those sorts of things. But the saline order had not been written, so I didn't really put the two together at first, but then, later I realized that it was because, um, you know, the order had not been written, and 4 days without treatment, I got much worse. And so at the time, there was a care coordinator for home health care that was covering for my regular one, and she was concerned about me. I said to her, "Can you get a nurse out here?" I really didn't want to go to the hospital. I wanted them to handle it and just take care of whatever they needed to do, and get me to a point where I could rest and feel better again. And they said, "Well, we can't get a nurse out here today. We're shorthanded." But the woman said to me, "I'm really concerned about you. I think they discharged you too early, and I really think that you need to go to the ER, and at least you'll get treatment that way. And since we can't get somebody out today, that would be your best bet, so that you can get this taken care of right now, before it continues to get worse." And I really, really didn't want to, but there again, it was mainly just a matter of, in my mind, a matter of, just being very tiring, and, I didn't want to go through the long wait and the hassle and all that. But finally, this feeling just would not let up. I mean, I was feeling so faint, like I was just this far away from passing out. And nothing I did, no position I sat in or lay in, made any difference. It was just absolutely unbearable. I couldn't take it anymore. So finally, I was like, okay, I guess I'm going to have to call 911 and go to the emergency room. I really didn't want to, but I went ahead and did it anyway. And at this point, I thought, well, okay, since most of my doctors are at Emory, or actually, I think all of my doctors at that time were at Emory. I said, you know, take me to Emory, and since all my doctors are there, I think that would be the best place for me to go, so that they can be notified, and, all my records are there and all that kind of thing. And I said, take me there and just don't divert this time. Maybe it would be better handled there, since I started out there, and then maybe they can, resolve this there. And I said, I don't know what they're going to do for me or what, but maybe we can finally get this resolved. So they took me over there, and I went in, and at first there were a bunch of staff that came in there, and it was not the same as Piedmont. I mean, I definitely kind of had the feeling that the people were not as attentive, and although they did come in and talk to me, and they did sort of the normal things like take my vital signs and all that, um, I don't know, it didn't seem quite the same. But the ER doctor, who was a female, she appeared to be very genuine and compassionate and all that. And I told her my situation. I said, I don't know what's going on, but I said, it's been taking forever, like pulling teeth, to get to where I need to be properly assessed and diagnosed. I told her my whole situation with my dysautonomic symptoms and the mobility problems and the systemic weakness and all of this stuff that was going on, the severe fatigue, all of this, the abnormal muscle movements, all of it. I was completely honest and upfront about everything that had been happening over the past 6 months to a year, because I genuinely thought that that they would want to know that, and to be able to help me. I never thought in a million years that anything really bad was going to happen. I just thought maybe it'll be a hassle, and I really don't like sitting and waiting. But the strange thing is, at first she was very apologetic, and she was like, "Oh, I'm so sorry, Miss Carlington. I, I'm sorry that it has taken so long for people to get things in high gear, and I fully understand that things really got severe really quickly, and that maybe they shouldn't have acted. I mean, they should have acted, more quickly in getting you to routed to the right place. But we're gonna, she said, we're gonna make this right. I'm really sorry. We're gonna make this right now and everything, and hopefully get you into that clinic, or referred to um, some place where they can do a proper assessment on you and everything." So I took her at her word. I had no reason to think otherwise. And I was just really, really sick that day. I mean, and I was, I guess, more withdrawn than I normally would be, just because I was so exhausted and I had been going through these symptoms, being hit so hard with them for so long, that I was just kind of withdrawn and quiet. And even though I tried to advocate for myself and try to ask for what I needed, I was more withdrawn than usual that day. And so um, I ended up, I noticed that after she said, she said, "If you need anything, just ask, food, medication, water, whatever, just ask, and we'll do it." And it sounded good, but then when the time came, I noticed that they had just left me in there by myself for a really long time. And I had told them that I was dysautonomic and I was having to drink ice water, all the time. I mean, I have a glass of water by my bed 24/7. I have to have that because I get dehydrated and I need to drink. Speaking of which, I was getting thirsty again. I need to drink throughout the day and at night too. I need to drink liquids, and so but they gave me a little tiny small cup of water about like this, and that was it. And it turned out that basically for a 9-hour period that I was in that ER, they didn't give me any more to drink than that, even after I had told them that I was dysautonomic and I had extreme thirst. I also had this horrible salty taste in my mouth that wouldn't go away. And so they gave me this little tiny cup of water, and that was it. And then they went off, and it seemed as if people were nowhere to be found. And I'm thinking, are they short staffed? And there again, I was still thinking that very innocently that they, were just busy or whatever was going on. I didn't think anything at the time, anything strange was going on. I just thought, well, maybe they're short staffed or they had an emergency come in that was like really life threatening or something like that, and they're called away to other patients. So I buzzed the buzzer a number of times, and they had also, the other thing was they had put an IV in my arm, but they didn't give me any IV saline. They didn't give me any fluids or any IV medications or anything like that, and it hurt like hell. I mean, it felt like they stabbed me with a dull shovel when they were sticking it into my right arm. And that was bad enough as it was, but then they didn't even use it. And I thought, well, I don't understand why why are they telling me they're going to do everything to help and, correct us and all that, and they're nowhere around, and I'm sitting here, I could be at home. If they're not going to really do anything to help and they're not going to treat me, I could be doing this at home in my own bed and I'd be much more comfortable. And so at one point, I called and I got somebody in there and I said, I'd like to speak with a social worker. And I told her, I said, I don't know what's going on, but I don't know where everybody is. And, I'm feeling horrible and I haven't been given any medication or anything like that. And I said, I really should probably have something to eat or drink. And she said, well, I'll go check on that and talk to the ER doctor and see if they could get you something. And I said, yeah, I need something for this GI spasticity, and I'm on tizanidine for that at home. And asked them if they can get me some tizanidine or something within that class of medications. So she went back and she tried to ask, and finally somebody came back in there after I'd been pushing the buzzer and pushing the buzzer and pushing the buzzer. And this nurse came in who seemed very annoyed and irritated that she just even had to do her job and even being called at all. And I'm thinking something about this doesn't ring true because the ER doctor said, oh, we're going to do anything that we can to help you. We're going to make this right, blah, blah, blah. And I'm thinking something doesn't jibe here. I don't know. She told me that, but that's not happening. And I need to get some help. Nothing is being done. And why am I not being given any medication? I don't know what's happening, why I'm not being fed. I'm not being given any water except for that one little cup. I'm used to drinking ice water throughout the day and throughout the night. I have it with me all the time. And so then they had at some point they had this mid-level hospitalist who was a man, and I remember he had a ponytail and tied in the back, kind of dark brown, kind of wavy hair. I guess kind of a hip looking guy, but kind of a nerd at the same time. It's kind of funny, but um, at the time, initially, I didn't really think anything about him until he started talking to me, and he was asking me about my symptoms, and I was explaining to him, and he did this neuro exam on me with testing the reflexes and all that, and he I said, I would like to find out what this is so maybe I can expedite it and maybe get into clinical trials. And then, since it's taken a long time, even to get to this point, I really don't want to be behind the eight ball and, have something that if it had been detected earlier, maybe it could have been fixed and now it can't. So I just really want to make sure that we can jumpstart this process, and so that I can get the best treatment possible for whatever this is. And it seemed that his demeanor was kind of sarcastic and snide and almost like he was toying with me. I guess that's the best way to describe it. And then he had a resident come in who was a female, and she chatted with me just briefly, talking about, that she was a neurology resident and that she was getting practice, working in the ER and everything. And I just sort of made casual conversation with her a little bit and, told her about, I don't know, I guess she asked me just some questions, and I told her about just briefly about my son, and that he had a DNET tumor, which is, basically some neural tissue that's, it's not a malignant tumor, but it causes him to have seizures. So she didn't know what that was, and so I just briefly explained. I said, well, if you're a neurology resident, I said, you're going to probably learn about that sooner or later, but, I'll explain to you what it is. And so I told her just briefly, and that I was just making conversation. I mean, that was all. and because she asked some of these things about family and that kind of thing. And so she did her neuro exam right after he did. And I remember having this thought, this is a little weird. Why? I know she's training and all that kind of stuff, but I just thought it was a little weird that he had just done this neuro exam on me with my reflexes and all that, and then she was doing it right after him. And she was making these comments that to me seemed, again, kind of chiding and not very respectful. Like, you know the drill, you know the drill. Like, I guess what came to mind was Nurse Ratched. That was what really came to mind with, when she said that to me. It just didn't feel respectful, but I couldn't put my finger on what was going on. I just knew something didn't feel right. And so she left and he left. And then I called the social worker in again and I said, I don't know what's going on, but I don't have a good feeling about this. I feel like I'm not being treated with respect. And I said, I just feel uneasy about this. And so she said to me, yes, I agree with you. But she said that she didn't feel like she had any power to do anything in the situation. And I told her, I said, this is making me uneasy. I said, I really don't know who to trust right now because I said, I don't know, the way they're relating to me is just strange and they're not really telling me anything, but I just don't have a good gut feeling about this. And so she said, yeah, I know. I agree with you. But she said, I got to go on to the next patient. So she did. She went on to the next patient, and I lay there, and my colon was just, I don't, it was just in spasm, and I was feeling like I had to poop constantly, and I couldn't. And so I tried to call the nurse and tried to call the nurse, and I guess there was an aide that came in, and I told her that. She brought in a bedpan, and I said, no, I said, I don't think I actually do have to poop, but I think it's just spasticity, but I need something for it. Could you go and get the nurse and ask them for my tizanidine or baclofen or something for spasticity? I said, I think that will help. Because I don't, I've had this for a while and I haven't actually gone to the bathroom. It's not like I've had diarrhea or anything like that. So I think it's spasticity. So she said, okay, well, I'll go ask. And then the nurse came in all of a sudden with a pill. And I said, oh, did you come in to bring me my tizanidine? Because I said, I haven't had my dose yet. Since I've been here for a few hours, it's really time for me to, have a dose of that. And she said, no, this is a benzodiazepine. And I said, what? I said, why are you giving me a benzodiazepine for spasticity? And she said, well, it'll work, it'll work for spasticity. And I said, I just don't really think that that's the appropriate medication for spasticity. I mean, I could see where it might work indirectly, but that's not the best thing to give for that. I said, I'm on tizanidine. I'm being prescribed that by my outpatient physician, and it's in my chart, that I'm on that medication. Could you please go back and get me my regular medication? Because I said, I think that will help. That will take care of it. Um, and she started putting her hand on her hip and going, well, no, I've been told to just give you this and that's it, something to that effect. And I said, look, I really think that, you know, this medication is not appropriate for, the medication you're trying to give me. And she wouldn't really tell me which benzodiazepine it was. But finally, I said, what exactly is the name of it? I said, and she gave me a generic name, and I didn't exactly know what that was off the top of my head. And I said, could you tell me what the brand name of this is? And she said, Valium. And I was like, Oh God, oh brother. So I said, I kind of knew then where she was headed with this, and I'm like, um, I'm here for a neurological problem. And I said, why are you giving me Valium for a neurological problem? And she really didn't explain, but she said, well, I told you it'll work for spasticity and blah, blah, blah. And, got kind of defensive and everything. And she said, no, I'm not allowed to give you your tizanidine or anything else. All they ordered was Valium. And I said, that doesn't make any sense. I said, come on, that's not going to take care of spasticity at this level. And at the time, I was just really miserable. And I couldn't take it anymore. I just said, look, I need this to be taken care of. Please, go get the doctor and let her know that, I really, I can't deal with this anymore. I feel like I have to poop every second constantly and it won't go away. And I said, please don't just let me suffer. I need something done, to alleviate this. And she went back, and I just started moaning and groaning in pain. I just couldn't take it anymore, and I just lay there and just groaned and moaned until I fell asleep because I was just so miserable, and I really didn't know what to do or how to make it go away. And it just seemed like everybody had taken off and left me there by myself with this pain and just feeling like crap, and nobody was really intervening. And I'm thinking, what's the point of me coming to the ER in the first place if they're not going to do anything and to treat this? And I thought, this is odd. Shouldn't they be doing something? And so then I finally fell asleep, and then I woke up, and, you know, the spasticity was mostly still there. The majority of it had not really resolved. And, maybe it got a teensy weensy bit better, but overall, it really wasn't enough to take care of it. And so next thing I knew, I mean, I had asked for the social worker several more times, and I think one or two more times she came in there, and I told them again. I told her, I said, I just don't feel like something is quite right here, and could you call my home health care agency and notify them, maybe have them talk to the doctor here. And so I gave her the number. I told her where my um, folder was that I had brought with me that had their information in it, and she called them, and they got on the phone with the doctor. The coordinator did, and then next thing I knew, the ER doctor was coming in and saying, "Well, we're going to admit you." And they had a bridge unit. I don't remember what they called it, but it was a unit that's sort of an intermediary unit between the ER and actual hospitalization, inpatient. And so she said they're going to admit you to this bridge unit, um, and you're going to be seen by a female neurologist. So I thought, okay, if maybe they're gonna finally do something and it'll work out okay. And so I waited and I waited and I waited, and nobody came. And I was still lying there by myself, and I was wondering what was going on. And they had put my bag with my laptop and all of my papers and everything across the room, so I was unable to reach it. And I wanted to contact some people that I know in the chronic illness community to update them on what was going on with me. But I couldn't reach my laptop in order to do that, and I wasn't close enough to the phone or anything like that to be able to call or email anybody or contact anybody online to let them know what was going on. But at that point, I don't know. I just wasn't sure what to think. But it seemed like it was taking an inordinate amount of time for me to get this resolved and find out what they were going to do with me. and whether they were going to send me home but they had been telling me that I was going to be admitted toward the end there, and that they were going to move me to a room. But this female neurologist never showed up. Then the ER doctor comes in and she says to me, "Well, there's been a change of plans. You're going to be seeing a male neurologist instead." And she said, "Did the female neurologist ever come?" And I said, "No." And she said, "Well, we have this male neurologist coming." And she said, I said to her, I said, "Well, does he have a problem with a strong woman? Because, I'm the kind of person, I'm a highly educated patient. I live alone. There's no caregiver. I have to take care of me and look out for me. So, I'm used to being an active participant in my treatment. And, you know, I just want to make sure that he's not the kind of doctor that has a problem with that." And she said, "Oh no, I'm a strong woman, and he doesn't do that to me. He doesn't give me any problems," or something like that. And she said he's an old traditionalist. And right then, it was almost like I had this visceral feeling like, oh shit, right there. I was like, oh no, that's not good. An old traditionalist is not what I need, because this is something that's out of the box, and I need an out of the box thinker, somebody who's progressive to really troubleshoot what's wrong with me, because apparently it's not an easy to diagnose problem, and it's something more rare. So, yeah, no, an old traditionalist is not going to be good here. I just felt it, right off the bat when she said that to me. But I still tried to comfort myself with the idea that maybe it wouldn't be so bad, and that maybe things would still work out. And so I then let me hang this up here. Excuse me. So then I just tried to convince myself that maybe things wouldn't be as bad as I thought they would be, and that maybe this guy wouldn't be too bad. He would come in and I would talk to him. I would explain what my situation was, and maybe things would work out, and I would get routed to the proper referrals that I needed to further investigate this problem. And so I waited a little while longer, and the ER doctor was like, "Oh yeah, it'll be okay," and she kind of reassured me. And at the time, what she said was comforting to me, and I believed her. I didn't have any reason not to at that time. I really genuinely thought that she wouldn't let anything bad happen to me, and that she was looking out for my best interest. And there again, like I said earlier, I was, fairly withdrawn at that point, because I was so sick and so exhausted. And I had been going through this for 9 hours, and I was just absolutely exhausted. And all I wanted was to get the help that I needed, and to get, on the right track, so that I could get treatment eventually for this. So they finally came and took me to the room in the bridge unit. And I decided then, I asked them to give me my bag with my laptop in it, and I tried to connect to their network, but I found that I couldn't connect. For some reason, it wouldn't connect. And I plugged in my laptop and tried this and tried that. Next thing I know, there's some people walking in my door. And I look, and it's the female resident that had been in there testing my reflexes earlier in the day, and a strange man whom I didn't know, who had a surgical mask on. And he was a pretty heavy set guy, I guess maybe medium height, with a somewhat bald head. And but he had a very, very serious look about him. And right away, I'm the kind of person that I really, really pick up on nonverbal stuff about people right away. It doesn't take me long to be able to read somebody. I mean, immediately, like that. And I had a very, very bad feeling of foreboding the minute that he walked in the door, because he seemed to be clenching his jaw and he seemed really tightly wound and, you know, really tense and kind of aggressive. That's the kind of energy that he was putting out. And I was very, you know, very uneasy about him right off the bat. And, you know, if I'd had it to do over again, I think I would now, knowing what I know now, I would have just asked him to leave right then and there. But there again, I was trying to be compliant. I was trying to work with them. I wanted to think the best, that they were there to help me, and I was trying to quell those fears, you know, and hope that maybe it wasn't all as bad as I thought it was. And so he came in, and right off the bat, he said, "Can you close your computer?" And I said, "I've been trying to connect to a network because I need to tell some people where I am, and, you know, some people in some of my illness groups may be worried about me because they knew I went to the emergency room, and I need to tell them what's going on. I can't connect to your network. Could you help me do that?" And he just reached over to my bedside table and closed the laptop without my permission or anything. And it seemed to me right there that was a very overt, you know, kind of crossing boundaries kind of motion. I guess that's the best way I can describe it. It seemed somewhat aggressive to me. And so he closed my laptop, and then he turned off the light. And my phone keeps ringing. I'm sorry. But he turned out the light. And then um, after that, he took his pen light out and started looking in my eyes and all that. He did that first. And then he went from that to the other part of the neuro exam that they normally do, you know, with the muscle strength testing. And then he went on from that to the, you know, testing the reflexes. And I noticed right away, I mean, the minute he touched me, that he was very, very rough. And I've had a lot of neuro exams in my life. I mean, I've had neurological problems since I was a child of various kinds. And I've been to enough neurologists to know the amount of proper force they're supposed to use. And I know there's a range. You know, some people can be very light handed and some people are rather heavy handed, but you can tell that it's not, you know, in any malicious way, that, you know, some people just don't know their own strength and all that. But there's definitely a difference between that and somebody who is trying to hurt you. And this guy, he seemed very aggressive and very angry, like he was an angry person, and not very nice. And the way he was going about it was way, way over the line of roughness. And but at first, I was still giving him the benefit of doubt, and he got rougher and rougher as the neuro exam went on. And when he was doing the reflex testing, he was pretty rough on my legs and my right arm. But then when he came around to my left arm, he raised the little, you know, triangular hammer that looks like a tomahawk that they use. He raised it above his head. He didn't get down to my level where I was lying on the bed on my back. He stood full up, you know, and raised the hammer literally above his head like that. And that was when I knew at that point that this had crossed the line from just being heavy handed and maybe he was in a bad mood that day or whatever, to out and out abuse. And I was scared. I was really scared, and he hit me as hard as he could, 2 or 3 times, very fast, like when you are intentionally beating somebody. And so I went like this, and I was like, ouch, as loud as I could, because I thought I need to really let these other doctors